Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, practitioner of functional medicine and board-certified doctor of non-force chiropractic. Most of the time we're talking about functional medicine on this show. My main mission of this show is to arm you with reliable information you can use to bridge that gap, to fill the gap between standard medicine and maybe why you're not quite feeling the way you think you should be. Maybe someone you love. Who do you know who has been to several doctors and been told there's nothing wrong with them, and yet still they don't feel all right? This is actually pretty common. When you go to your typical medical physician, your general practitioner, your gynecologist, whoever you go to for your annual physical, they're not looking to see if all of your organs and tissues are functioning 100%. And another way to say that is they're not looking to see if you're truly healthy. They're looking to see if you need medical care today. The purpose of a medical evaluation is to determine whether or not you need medicine. You need a pharmaceutical, you need some kind of drug or a referral to a specialist or some kind of imaging test to diagnose you, with the ultimate goal of providing some kind of drugs or surgery or other medical procedure to address a medical condition. And that's different than evaluating for health. That is different from determining whether or not your immune system is functioning optimally, and if your vitamin D level is sufficient to make that immune system, could contribute to that function of your immune system to keep it at its peak, among several other things. Something simple as a complete blood count, a common test. It's amazing to me that most doctors don't do this routinely unless they suspect an anemia. If you have severe fatigue or any other thing in your case history that might lead them to believe that you could have anemia, or very commonly, if you have signs of an acute infection. If it looks like you have a cold or a flu, a fever, they're going to do a complete blood count and check your red blood cell count, your hematocrit, your hemoglobin, and your white blood cell count. And most of the time, they're just looking to see in the setting of an acute infection, a cold or a flu, anything that causes a fever or the other signs and symptoms like that. They're looking to see if your white cell count is elevated, because that confirms that you have an acute infection. Your body is ramping up production of white blood cells to fight off and kill that bug. But what if your white cell count is low? What if it's in the 4s or even lower, 5s, 6s, or 7s, where your immune system is functioning at its peak? A lot of doctors just ignore that. And what it means, if your white cell count is low, and, we're still within the medical range on any particular lab might be down as low as 3 point something. But truly, if it's below 5, the mid 5s, then that usually means that your body is struggling to fight off some kind of bug, some kind of virus or bacteria, maybe a parasite, maybe a fungus, something in your gut, a dysbiosis, an imbalance of good or bad bacteria in your gut, something in your sinuses that's lingering that makes your head feel like there's a slight pressure there all the time. Or I had a patient that came in this morning that said her head feels like it's filled with cotton balls. And that's what it feels like when you have something still lingering in your sinuses that your immune system's never able to completely fight off. And when that happens, you'll usually have a reduced white cell count because your body's not keeping up with demand. Your immune system has that chronic stress on it. And so it's important to distinguish chronic from acute. Acute is something that everyone's familiar with. An acute infection is a cold or a flu or some other kind of infection that causes a fever, the symptoms that we're all familiar with when you have an infection. A chronic infection doesn't mean bad, doesn't mean mild or strong or anything like that. It just means it's like chronology or chronos. It means that it's been there for a long time. Something that's taking place over a longer period of time is a chronic infection. And that's why it's difficult for your immune system to completely fight something off. Well, that represents something that your immune system is struggling to fully get rid of, and that will often respond to a little support, maybe some more vitamin D or vitamin C, something as simple as that. There's this particular product that I use anytime someone has a lowered white cell count called Lauricidin, Lauricidin. It's an unusual product. It comes from coconut, but there's no significant amount. The single ingredient in Lauricidin is called monolaurin, and this comes from coconut. It's actually in human breast milk that helps set up your immune system when you're born and you're a nursing infant, and then you really don't get much of it in your diet after that. There's no significant amount of it in fresh coconuts or in coconut butter or any coconut product that you can take. It takes a lot of coconuts to make a small amount of Lauricidin. But it's an amazing product because anyone can take it, even infants can take it. And it is antiviral, antibacterial, antifungal. It helps fight off any bug, supports your immune system in doing that. And I've been using it for, 25 years, I think, and it works about 90% of the time. So who do you know that just feels a little bit run down? Often, the only symptom of a chronic infection with that depressed white cell count is just fatigue. You just have no energy for no reason. And there's never one cause for fatigue. It's usually a dozen things, half a dozen things at least, small things that add up to this state of just never having the energy that you feel like you should. So who do you know that has low energy for no reason and can't figure out why? Maybe they've been to several doctors and been told that there's nothing wrong with them. And part of the reason that happens a lot because most medical doctors do more or less the same thing. They're going to do the same blood tests and look for the same broad changes from a much broader range to determine whether or not you need some kind of medication or other medical therapy. When you narrow that focus and use what we call the functional range on those same blood tests, we're looking at a narrow range. What does your blood look like when you're in your teens and your 20s and everything's working perfectly? That's what we call normal function. And you can look for that, things that are outside of that same range on any standard medical test and identify things that need support. Often simple supplements or a change in diet or sometimes more exercise along with that. But there's almost always a safe, effective, natural solution for any problem like that. And using this more narrowly focused analysis of standard blood tests is usually how we get to that solution. So if you know somebody that could use some help or if you just have questions, email me at drbinkley@binkleyhealingcenter.com. That's DRB as in boy, INKLEY at binkleyhealingcenter.com. You can also text me at 805-218-3939. I'm happy to answer your questions and I look forward to helping someone that you might know that could use a little support. So today we're going to talk about some things that can increase your risk of heart disease, some really interesting research that's come out that shows that having chronic kidney disease increases your risk of heart disease. Well, how do you know if you have chronic kidney disease? If you've ever been to the doctor and been told that your kidney tests are a little bit off, but there's nothing to do about it, that's also pretty common. When the kidney tests, it's a little technical, but the kidney tests are creatinine, blood urea nitrogen, and glomerular filtration rate. So that's a lot of words that you don't really need to know what they mean, but those are the three tests that most doctors will do. Anytime they do any blood work, they will do those tests. And if your kidneys are struggling, then those numbers will increase or decrease. And so a lot of people here, I've had several patients come to me over the years that have been told, oh yeah, my kidney tests are always a little bit off, but the doctor said there's nothing to do about it right now. Well, if your kidneys are struggling, there are lots of things that you can do for that I can do for that, and that don't involve medication, that involve supplements to support the kidneys. It's oftentimes difficult to figure out exactly what's causing the strain on the kidneys, but you don't even need to know always exactly what the cause is. You can just treat the kidneys. You can give the kidneys nutritional support, and they will often heal themselves. Well, there's even more reason than ever to check and to do something about that, even if your kidneys are just a little bit out of range, because there are traditional risk factors that occur in both situations, heart disease and kidney disease. For example, a higher instance of diabetes and hypertension, high blood pressure. But even apart from those, people with chronic kidney disease have a higher incidence of heart failure. So says a study that was published in Circulation in November of last year. And the reason they even isolated something that's underneath this, it's a little bit technical, but they identified these things called circulating extracellular vesicles. So these are things that can trap other lipids, can trap microRNA and other types of RNA that translate into various proteins. And so they isolated these, and everybody has small amounts in the bloodstream. But when they had RNA, extracellular vesicles with RNA, they were toxic to the heart. And if they neutralized them in a mouse, then it did not cause heart failure. And so there is a model of a pathologic kidney-heart communication through these circulating vesicles in the bloodstream that are unique to people with chronic kidney disease. So that's a technical way of describing why, but the bottom line is if you have any kind of long-term stress on your kidneys, then it is going to increase your risk of heart failure. Heart failure doesn't mean your heart stops, Doesn't mean you're having a heart attack. Heart failure just means your heart is weak. It's not keeping up. It's failing to keep up with demand. This is a common cause of natural death in old age when you get to the point where your heart is so weak that fluid starts to back up in your ankles and in your lungs. That's because your heart is failing to keep up with demand. So your risk of that is increased if you have any kind of long-term stress on your kidneys. So that's an easy thing to check. Almost any blood test will include those things. And if they're not within, even if they are within the standard medical range and your doctor told you they were fine, if they're not within that healthy functional range, then one way you can reduce the stress on your heart so that you can be more likely to live long and live well, which is always my motto, then get your kidneys checked with a simple blood test. Here's another marker, Lipoprotein A. I've talked about this before. There's another study that just came out. It's a simple test. It's $35 from LabCorp. Lipoprotein A is another factor that determines your long-term heart risk. This is a study that came out in the Journal of America, JAMA, Journal of the American Medical Association Cardiology. And this is a 30-year outcomes among participants in the women's health study that showed an increase in major cardiovascular events associated with increasing lipoprotein A levels starting around 30 to 60. So your risk increases between 30 and 60, but if you compare the highest levels, so patients in this 30-year women's health study outcomes, the people that had the highest, greater than 120 milligrams per deciliter of the lipoprotein A test, compared with people who had 10 or less, so the two extremes, the people with the highest levels had a 54% increased risk of a major cardiovascular event, 80% increased risk of coronary artery disease, 41% increased risk of ischemic stroke, and a 63% increased risk of death from a heart attack or stroke, cardiovascular death. So, these are some pretty big numbers. And importantly, even just at the 30 level or above, were associated with significant increased risk. Women in the most extreme percentile having approximately 74% higher risk of future cardiovascular disease compared to individuals with lower levels. So this was in the Women's Health Study from 93 until the present, 27,000 participants, and they had the lipoprotein A measurements on 23,000 of them. The median age was 53. Now, this test is determined by your genes, so it's not something that's easy to modify. It's not like your cholesterol where you can do something to lower it, although pharmaceutical companies are trying to work on something that can lower it. But for all the information we have now, it is determined by genetics. But why? So it's still, even if you can't lower it, if it's elevated, it's good to know because you can do other things to reduce your risk, and it will motivate you perhaps to do other things to reduce your risk. So a lot of people come to me and want to know if they can reduce their risk of heart disease because their family members have died of heart attack or stroke. It's a good reason to do that. If you have anybody in your family that has died of a heart attack or a stroke, or your loved ones have that family history, then you should get your heart checked. And most people are only familiar with testing for cholesterol. And cholesterol is, a useful marker, but by itself, it's not a very good measure of your heart disease risk because most people who end up in a hospital with a heart attack or stroke, half of them have normal or low cholesterol because cholesterol doesn't cause heart disease. It is strongly associated with it, but heart disease is caused, hardening of the arteries is caused by inflammation that creates micro tears in the lining of the blood vessels, which are then healed with a scab-like thing that becomes a plaque, and that plaque is made up of fibrin, scar tissue, calcium, and cholesterol. So if you don't have a lot of tears, then you don't have a place for cholesterol to stick to it and build up. And so you can have high cholesterol and low risk of heart disease. If you do have a lot of those tears, if you eat a really lousy diet, have a lot of stress, and therefore a lot of inflammation in your circulatory system, then you are likely to have a lot of those tears, and it will be important for you to keep your cholesterol in the normal range. Doesn't mean you need to make it low. It's not good to get it too low. Cholesterol is an essential nutrient. It's essential to build cell membranes and hormones. All of your hormones and your cell membranes are made with cholesterol. That's why there's always a normal amount of it in your blood. It is essential for life. So I've seen a lot of patients too that are on statin drugs for cholesterol, and their doctors want to lower their total cholesterol way below 200 or their bad cholesterol way below 100. That's not good either. That can cause problems. But some people have family history or a familial high cholesterol level. They're genetically programmed to make more than normal cholesterol. So what are they going to do if they still don't want to get on statin drugs? Well, if it's really high, if it's above 300, maybe they'll want to consider it. But there's lots of things to try before you go that route. And for example, if we look at all the other risk factors for your heart, things like the measure for inflammation, for example, C-reactive protein is a measure of systemic inflammation throughout your body. If that test is low, another test is called sedimentation rate. This measures the thickness of your blood. The viscosity of your blood is measured by a test called erythrocyte sedimentation rate. And ferritin is another marker. It's your body's form of stored up iron in your body. When you have a lot of inflammation, that number tends to go up. If all of these numbers, as well as now this other one, lipoprotein A, if all of these things are low, then you know that if your cholesterol is a little high and your blood pressure is a little high and you're not ready to start medication yet, then you know that you have some wiggle room. You have your heart is basically appearing not to have too much stress on it. Actually, there's one more test that's really important that I recommend for anyone who has potential stress on their heart, meaning they have a little bit high blood pressure or any kind of family history or significant stress in their life, and it is called BNP, B-type natriuretic peptide. This is a protein fragment, a peptide in the blood. There's always a normal amount of that in there. Your heart muscle cells turn over, and that protein from those heart muscle cells liberates a fragment called this B-type natriuretic peptide. It's a feedback loop between the heart and the kidneys. So if there's extra stress on your heart, this level in your blood goes up. It signals the kidneys to dump more fluid to take pressure off of the heart. So if that is also low, that's the test that when you hear about these people that suddenly drop dead of a heart attack for no reason, that appeared perfectly healthy, and then they're out playing basketball and drop dead, or they're out jogging, they drop dead when they seem perfectly fine. If you had done this test, BNP, on those people 2 months earlier, it would be elevated. It will show that kind of hidden stress on the heart when you feel no symptoms at all. Kind of like high blood pressure has no symptoms until it's really bad. But if you do these tests and your heart's okay, then you have some time to try alternative methods to get your cholesterol down and get your blood pressure down, of which there are many. I always have to remind people that if your blood pressure is really high, if your blood pressure is above 140/90, or especially above 150 or 160, for more than a few weeks, then you definitely want to consider getting medication and you've tried everything else. So there's lots of things that we can do to get your blood pressure down. We can show you some things that will relax stress, relieve stress that you probably may not even be aware you have. A lot of people say, "Oh, I'm fine. I don't have any stress. I love my life. I love my job. Everything's fine." But you check their blood pressure and it's elevated, and especially the top number is elevated and the bottom number isn't, then they've got some kind of stress going on that's causing the muscular wall of those vessels to tighten up when they don't need to and keeping that pressure up. So there's lots of ways to reduce that naturally, but if you can't, then it is important to always take your blood pressure medication. It's that important to keep the pressure low one way or another. So if you can't do it with natural methods, and I sometimes do recommend people get medication for that. And of course, if they're already on blood pressure medication, that I never recommend they stop it unless or until they talk to their physician who prescribed that medication and they do something, which I can help them with, to get the pressure down. So it is possible to get off of blood pressure medication, but you don't do it until your pressure goes down. When you do these things to naturally lower your pressure with some nutrients and yoga poses, deep breathing exercises, there's lots of things you can do to create deep relaxation in your body in ways that you may have never experienced before. A lot of times the people will say, "Oh yeah, I do deep breathing exercises." "Oh, for how long?" A minute or two. That's not what I'm talking about. Why not? If you feel a difference when you do that, great. During the middle of the day, a quick break or something. But the lasting effects where you can literally lower your blood pressure several points and keep it down, then this involves usually lying on the floor on a firm surface or a table, not on a couch, not on a bed, usually not sitting up either. But if you lie on a firm surface and do deep breathing exercises for more like 15 minutes every day for a while, then you can produce some amazing changes in blood pressure, and you can check it and prove it to yourself. You can get a blood pressure cuff to use at home, check your blood pressure. When it's high, lie on the floor, do some I can explain to you how to do this, some deep breathing exercises, long, slow, deep breath in, hold for a little bit, long, slow, deep breath out, repeat for about 15 minutes. And you'll see a huge difference, oftentimes, a huge difference in lowering your blood pressure naturally. I'm Dr. Todd Binkley. You're listening to safe, effective, natural solutions to almost any health challenge. Who do you know that's having something going on with them, that's been to the doctor? They're told there's nothing wrong with them medically. They don't need any treatment right now, but still they don't have the energy that they should have. Or their blood pressure is going up. Or you're just wanting to get checked. You know, you had a close family relative, or several maybe, that died of a heart attack or a stroke way too young. Cardiovascular disease is the number one cause of death. So most of us know somebody like that. It is important to get your heart checked, and a little bit differently to the way that most medical doctors are. Don't just get your cholesterol checked and rely on the standard recommendations. If you truly want to know how healthy your heart is, it requires doing some extra testing, like some of the things I just talked about. Even in addition to that, there's a whole cardiovascular profile that has some other tests that I haven't talked about yet on this episode, including things like a plaque test, circulating plaque, apolipoproteins A and B. There are special forms of cholesterol that are the very worst ones. Beyond your total, your good and bad cholesterol, there are things like particle size, the small particles of the LDL bad cholesterol, and something called oxidized LDL. These are even more atherogenic. These are even more likely to cause and contribute to an increase in hardening of the arteries, arteriosclerosis, heart disease, increase your risk of heart disease and stroke if those numbers are high. So it's a very sophisticated test that most doctors never do that can really give you a much clearer handle on how healthy your cardiovascular system is. A lot of people want to know if they've had some lingering effects from COVID because of the spike proteins in COVID. We've heard a lot about how that irritates the lining of your blood vessels and creates inflammation. And so these are some of those tests that can help you identify the lingering effects of that as well. I did my preventing heart disease talk in the office last week. We had a great turnout, and one of the ways I like to summarize after I do that lengthy talk is three things that you can think of for preventing heart disease. Keep the pipes clear, keep the pump strong, and keep the pressure low. So we just talked a little bit about how to keep the pipes clear by reducing inflammation and making sure that your cholesterol is under control, but the other factors that evaluate whether or not you're inflamed. You keep the pipes clear by lowering and maintaining low amounts of systemic inflammation. So keep the pipes clear, keep the pump strong, and keep the pressure low. We talked about how to keep the pressure low. And so how do you keep the pump strong? Everybody knows that. You exercise. Find a way to move your body. What's the best kind of exercise for you? The one that you'll actually do regularly, a little bit every day, or at least almost every day of the week. Find something that you enjoy, whether something as simple as walking is great. You don't need any memberships or special equipment to go for a walk. If you walk fast enough that you start to get a little bit short of breath, it's a little bit difficult to talk to the person next to you like that, then your heart's usually up in a good target range. You don't even have to have one of these devices. But of course, if you've got a smartwatch or a Fitbit or an Oura Ring and can measure all the specifics when you're doing your exercise, even better. It's good to have those metrics as well. But yeah, do something to keep the pipes clear, keep the pump strong, and keep the pressure low so that your heart will last as long as you need it. I'd love to answer any questions you may have about that. If you know somebody who would like to get a really sophisticated, more detailed, in-depth evaluation of how strong and healthy their heart is, have them give me a call or shoot me a text at Dr. Binkley. Email me at drbinkley@binkleyhealingcenter.com or text me at 805-218-3939. We're about out of time here, so I'll also remind everyone, remember, anything you do to protect your heart is also going to tend to protect your brain. Most of the degeneration that results in dementia and old age involves loss of circulation to that part of the brain. The same process that slowly cuts off circulation to your heart, causing a heart attack, is also cutting off circulation to your brain. And so exercising, keeping the pipes clear, and keeping the pump strong will also reduce your risk of dementia. And most people don't even have symptoms of dementia until 30% of that part of their brain is gone. So do something this weekend to be a little bit healthier than you were last weekend. Go for a walk, call someone you haven't spoken to in a while, do something you love to keep that pump strong. Have a fabulous weekend.
You've been listening to Safe, Effective Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at binkleyhealingcenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones, because our health matters. Tune in every Friday at 2 p.m. and Saturdays at 3:30 p.m. for safe, effective natural solutions right here on 98.3 FM, The Word.